Correct. I guess I'm a unusual orthopedist because I'm into not hurting anybody, and I really like to use natural medicine if I can. And that took me into becoming certified as a anti-aging doctor, and that got me into the Scripps Institute of Alternative Medicine. And when you carry these circles, work in these circles, you get exposed to multiple alternative types of non-traditional things. And I learned a couple of years ago about using platelet-rich plasma and stem cells for treatment of orthopedic problems, and that's taken me to a very wonderful place, and I'm enjoying helping people with using it with surgery and without surgery.
Well, and again, I want to, not that anyone needs to clarify your words, but I want to clarify to the folks that obviously the multiple people that visit the show and who are healthcare providers, none of them mean to cause harm or pain to anybody. And the reality is, though, that you've kept an open mind, I believe, and that's the way I view it, to a lot of information that's coming your way, and you don't say, oh no, you say, why not?
Right.
Is that what I hear from you?
That's correct. That's correct.
Right.
You want to minimize the risk for the reward for people. And everybody knows if you take an anti-inflammatory, you can burn a hole in your stomach, it can cause kidney, liver issues, and if you could stay away from that and take natural herbs and chondroitin glucosamine and antioxidants, and if it works, it's healthy, it's heart healthy, it's healthy for the whole body. And in that light, if you have someone with arthritis or a torn ligament or a torn tendon or a muscle injury, instead of having surgery, you can use the growth factors in our blood. What we do is we take your blood and extract the platelets, and we use the growth factors in platelets, which are many. There's many, many growth factors in platelets, and if they're not in the platelets, they actually stimulate your body to activate these growth factors. So what they do when you bleed or after a trauma, the platelets release the growth factors, and they bring over what factors you need. If you need fibroblasts, you need new blood vessels, they manage it. So we take that knowledge and we put it somewhere where you don't bleed in an injury or an arthritic condition, and we tell the platelets, go over here and do some work. And we add stem cells to that, and the stem cells can become, and what we call modulate, become any type of cell you need it to be. So if you take stem cells from bone or from fat, these are adult stem cells and not embryonic stem cells. I don't do anything with embryonic. These are called mesenchymal adult stem cells. They come from the bone. Actually, the whole body has stem cells in them. Every part of our body has stem cells in them. But we can extract it easily from fat and from bone. And we take those stem cells and we put it, like, for instance, arthritic condition, arthritis. What is arthritis? The loss or damage of cartilage in a joint. So you want to restore the cartilage quality or quantity. So what you do is you take fat or bone, and you extract the stem cells, and you add the growth factors of the platelets, and the platelets stimulate the growth of the stem cells, and you have cartilage growth, which I think is amazing.
So in oversimplistic terms, although they were rather direct, what you're doing is you're taking platelets, which are the managers, correct?
Correct.
And you're extracting human stem cells from fat and or
bone marrow,
and then you're placing the stem cells with the platelets into an area that is injured or morbid relative to orthopedic issues, and there is a direction of growth factors, and therefore you mitigate the pain and you rebuild or retissue, in quotes, not a very good medical term, the area. Is that what we're talking about?
Yeah, that's basically it. I mean, basically, everything in the body heals with scar tissue except for bone. If you break a bone, it makes new bone. If you make a tendon, it heals with scar tissue, ligament as well. But if you take stem cells and you put it on a tendon that's torn, guess what? It almost duplicates that tendon, and it becomes as strong as it was before, which even our natural healing doesn't do that. If you take a tendon and put it together, it's not healing with new tendon, it's healing with scar. So that's the most amazing advance. So I took it out of the OR and I brought it to the office. Now we use it, lots of people use it in the OR. A lot of people compliment their surgery.
Not to interrupt you,
no,
but
no problem.
Folks, the OR means he's talking about the operating room inside of an ambulatory surgery facility or the hospital. Yeah. I'm sorry.
I'm sorry if I'm talking too much.
No. Good. Keep on going. Yeah. You never talk too much to these folks who are viewing us.
Okay. Basically, about 30 years ago, a cardiac surgeon called his friend in pathology and said, could you do me a favor? Make me a bottle of platelets. So I'm going to see if I can do something. I want to see if I can make it heal faster and stop the bleeding. And he took a bottle of platelets that the pathologist made with his own blood, and he, after this major open heart surgery, which is pretty major 30 years ago, I mean, the chest is wide open, there's lots of complications, a lot of bleeding. He puts it in the heart, he puts it all around the healing, and guess what happens? The patient heals twice as fast, and there was no bleeding because the platelets clotted, and he solved the problem of bleeding. But he kept quiet about it. He was like, ahead of his time, and was kind of said, I can't tell anybody about this. And it's been quiet. And then what happened, the oral surgeons who do these crazy wild osteotomies where they rearrange the bone and put implants in, were having trouble getting these implants to stay in the bone in a strong way. And they came up with the idea of using platelets, and they really led the way. And then the orthopedist came afterwards. So, and then you saw, I guess, the day before the Super Bowl, the day of the Super Bowl, you saw that Hines Ward, the first word out of the telecaster was, by the way, this Hines Ward had some crazy blood injection. He wouldn't be able to play. And what he did, he had platelet-rich plasma placed in a torn tendon, and he healed so fast he was able to be a star in the Super Bowl. I think, what's that, 2 weeks after this playoffs from the Super Bowl is only 2 weeks away. Mm-hmm.